The New York City Workforce Innovation Fund was created so that private philanthropy could work with New York City government on creating a better system for New York City job seekers. Our goal as a group of funders from the time we started in 2000 was that, and we knew that we needed city government as a partner. The New York City Workforce Innovation Fund was where the city and the private philanthropy came together. In 2010, really in response to the Great Recession, we refined that whole approach in particular sectors. And actually, the New York Community Trust spent a year designing what we called a meta-partnership for healthcare in New York City.
In partnership with the New York City Workforce Funders, we launched a sectors initiative in healthcare with a few specific training tracks, which was our first foray into sector work and was very successful. It became clear that an actual industry-focused workforce intermediary would really benefit the city. So about 3.5 years ago, we together with the funders launched the New York Alliance for Careers in Healthcare, or NYACH.
NYACH's mission is to ensure that the healthcare industry has the workforce that it needs, and we do that primarily through 3 different ways. The first is to identify what are the new jobs and emerging positions that are coming out of, particularly out of healthcare reform, and what are the skills and the credentials that are required now to meet that high demand. The second is to ensure that education and training programs are designed to meet those needs. The third is to focus on New York City's low-income and unemployed population.
After nursing school, I found out that getting a job was very, very hard. Transition to Practice program enabled me to be in my dream hospital, New York Presbyterian.
There's a lot of changes taking place in healthcare delivery right now. There's a lot of collaboration that's being driven in the healthcare industry. I think that you're seeing that played out a lot with hospitals, nursing homes, home health agencies and whatnot, really to try to create better health for their communities. NYACH is really the perfect forcing function to really drive change.
Probably the most important piece of NYACH's impact is the systems change piece. And by that I mean that when we work on one specific training initiative, that we're not just focused on the outcomes of that initiative. Bigger than that, we want to ensure that program is then replicated and sustained across the workforce system, both by educators in providing that program and by funders in investing in that program.
Ever since I was in nursing school, I always wanted to end up in the hospital. And now I'm a nurse at NYP, and I absolutely love it.
NYACH was an inspiration to us as we looked to strong models that would help create mobility for workers in New York City.
Having the advantage of an industry partnership to help inform our training makes our investments much more effective, because we're able to be much more certain that the training we're driving people to is going to lead them to a job. And there's nothing more important than that.